Do you smoke? Do you drink? Do you do any physical activity? These are some of the questions that you're gonna be asked when you do your NHS health check. I work in a stroke rehab, and I have seen patients very young, in their 40s, 50s, even in their 30s, having a stroke because they don't have very good health lifestyle habits. So that's something that you might want to start thinking now that you are turning 40 or that you are 40 plus already. Everyone is at risk of developing diabetes, heart disease, kidney disease, stroke, and dementia, but these conditions can be prevented if you start making some lifestyle changes. So I'm gonna be discussing the booklet you might get when you do your NHS health check. But if you don't get this booklet, you can find it in the description below. It's the official one from the NHS. So as we get older, the risk of having cardiovascular diseases increases. Things like having high blood pressure, having high levels of cholesterol, being overweight, maybe not doing any physical activity at all. Obviously, smoking is a no-no. Drinking a lot of alcohol. I'm going to talk about alcohol in a bit later on because I also drink alcohol, but I try to stay within the low risk limits. And also, if you are pregnant or if you were pregnant and you have high blood pressure because of the pregnancy, or you have diabetes gestational, again, having high blood sugar because of the pregnancy, that also can increase your risk of developing these conditions later in life. So this is the time when you need to send some time for yourself and go and have a checkup. Sometimes you get a letter from the GP saying that you are invited to have the NHS health check, but if you don't have the letter, you just can go and ask if you can have one, or if you are very curious like I am, just get a blood pressure machine. You can buy one on Amazon or Boots, and you can take your blood pressure at home if you want to know your readings. And then if you want to check your weight, just get scales and do it at home. And the only thing you will need to have done in the GP practice is the blood test to check your cholesterol levels. So when you get the booklet, it gives you a lot of information about the health check that you are having. And one of the things is blood pressure. If you don't understand anything about the blood pressure, this booklet explains in really plain English. It's really easy to understand what you are looking for. And ideally, you need to have blood pressure readings around 140 over 90. This is considered to be within the parameters of good blood pressure. If your blood pressure is above that, it means it's high. Ideally, you're gonna have to take it 3 times. And if the best of the 3 readings is still high, then you need to speak to the GP or the nurse practitioner and tell them that your blood pressure is high. They will run another checks just to make sure that the blood pressure is high because other reasons, and nothing to worry about. But just tell them if your blood pressure is about 140 over 90. When you check for your body mass index, is about being overweight according to your height and your weight. And again, there are some parameters that you need to be within. The booklet has colors, so you can identify when you are at risk and you need to do something, or when you are in the normal range. Again, in the booklet, it explains you, and also you can use the NHS calculator just to calculate your BMI, which I'm going to leave the link in the description below for you to check. Cholesterol levels, obviously you need to go to the GP to have blood tests taken, and if the results are quite high, they might start some treatment, but if you change your lifestyle, you might be able to correct them without treatment. Again, it's everything about eating healthy and lifestyle. But again, it has some colors so you can understand where you are at the moment. So when all this information is gathered into the system that the GP uses, it shows you some score. It's called the cardiovascular disease risk score. And this information will help the clinician to identify if you are at risk of developing cardiovascular diseases. Again, it gives you some numbers for you to start doing something now. alcohol and smoking, there is some guidance that you can follow. Ideally, with alcohol, it's better not to drink at all. Alcohol is not something people should be doing, but obviously we are human beings, and you know, you do what you do to stay sane. I personally drink alcohol. I drink one glass of wine sometimes in the evening, but I always tell my patients stay within the limits, and there is the guidance. So in the booklet, it tells you what the guidance is about. So it says men and women are advised not to regularly drink more than 14 units of alcohol a week. And it gives you some information that of what that it means for the check. But if you are curious, you can just go online and put the stuff you are drinking. Let's say if you are drinking beer, if you're drinking wine, how much wine you're drinking, and it will give you the units that you should be drinking, and it will tell you you're drinking a lot or you are drinking within the low risk limit. Again, drinking is not safe, it's not good, so better not to do it. But if you want to still do it, just stay within the limits. That will help you a lot. With smoking, if you smoke and you are struggling to quit, there are lots of resources that can help you quitting smoking. But I always tell my patients is whenever you feel ready to quit. I know it's difficult. It's really hard. I'm sure with all addictions, it's really hard just to give up one day and don't do it again. So when you feel ready, try to find that information and have it handy. So if you get the booklet from the NHS Health Check, have those information ready for when you feel like you want to quit, and contact those people, because it's free. It's through the NHS, and sometimes I feel like we need support to give up things like that, like smoking or drinking. Again, with exercise, it's the same. But have the information if you are not ready to give up now. Just have the information ready in case when you feel ready you need support, because it's free. But again, smoking is not healthy, it's not good, it doesn't help anybody, and it increases your risk of developing cardiovascular diseases. Healthy eating, which is the big topic, and it's something I'm passionate about. I really believe that whatever you eat, it will reflect the way you feel, the way you skin looks, your body looks, everything. So eating is a big thing for me. People always ask me about my own routines, because I have lots of energy. I do a lot personally. I do a lot. I do lots of physical activity. I try to engage with my children when I'm around. I work. I study. English is my second language, so I'm always learning new words in English. And for that, you need to feel well and you need to eat well. And one of the things I add to my routine of drinking, let's say I drink green juices every morning, and I always add collagen. I think collagen is something people should start adding to the diets, especially when they turn 40, and especially if you are women. Women need lots of collagen. And I also encourage you to eat supplements, vitamin D, especially vitamin D and iron, because again, women, we lose a lot of blood when we have our cycles, our menstrual cycle. So adding iron to your diet is something you should be doing, and vitamin D. In England, we really struggle with sunlight, so taking vitamin D supplements will help you a lot in the long run. The thing I always add to my diet is omega-3s, omega-3. Omega-3, I add omega-3, collagen, and protein. Protein is something you really need to add to the diet again. In terms of salt and sugar, I always say my patients stay within the limits. If you can avoid it, don't have any sugar at all, because it increases the risk of having diabetes. But if you can help it, just measure, be cautious of how much you are adding of sugar. And the same with salt. Maybe sea salt is a healthier option. There is lots of healthy options that you can use instead of the refined stuff, which again the NHS website have lots of advice on. So I'm gonna leave the links below for that, but just check it out, because whatever you eat, it will reflect in your health, physically and mentally as well. Physical activity is another big thing that you need to add to your routine, your daily routine. We always advise to do at least 30 minutes of physical activity whatever you can add to your busy life, please do. I personally like cycling, so I try to cycle everywhere I go. And sometimes I do weights at home, also helps. But whatever works for you, try to find that those 30 minutes a day, because it will help you. For example, I always advise my patients, if they have steps, just to walk up steps. If they work in places where there are steps, use the steps, walk to the bus, try to add any physical activity to your daily routine. That will help. 30 minutes a day. There is this website called Change for Life, and they have lots of activities of how you can engage in your local area. So I suggest just having a look, because it also helps with children. You can do stuff with children. Something I always advise is a park run. We have one in our area, and it's also for children. There is one for children and there is one for adults, and it's a nice activity to do on Sundays. It's a bit early, about 9 o'clock, but it helps you just to get out of the house, have the kids with you. Maybe you can volunteer if you like, and get that activity done for the day. Because it will help, and it also creates a really nice routine around your family dynamics and being active. And don't let the weather stop you, because you are in England and you won't get much sun around the year unless it's a really hot summer. But winter, autumn, try to stay healthy and active. Try to stay active even during winter. Get out and get as much sunlight as you can during the winter. Booklet also has some goals for you to achieve, and this is something I always align with purpose. So if you are watching this video until the end, you might be interested in why I am talking about the NHS Health Check. Well, A, because most of my friends are turning 40. B, because I work in a stroke rehab, and I see lots of patients that have had a stroke and haven't had any information about the health check, and I think it's important to raise awareness. But most important is because I have my own family, and now that I am a mom, I think I find a purpose on that. I want to be healthy for them, I want to be healthy for my children, I want to be healthy for my patients and for myself. So I think it's important to look after ourselves if we want to look after others, and that can be written in your goals. If you are a parent that want to improve your lifestyle for your children, put that I want to be healthy for my children. And then you can start developing different routines, like giving up smoking, drinking less alcohol, doing more exercise, and the big thing, trying to sleep. That's something parents can't do much, but if you can afford it, please try to have some good sleep, because it will help your body resetting for the next day. Remember, my name is Leslie, and I'm just sharing tools and information that I have learned in my journey in the NHS. I'm giving you some tips if you are looking for some tools to make your life easier while you are working in the NHS. I hope you like this video. I'm gonna leave all the information in the comments below. If you have questions, please leave them there. If you want me to talk about something else, please also leave in the comments. And if you like it, please share it and subscribe to the channel. See you next time. Bye.